Did you know that cancer is the number 2 killer in the US? Did you also know that 1/3 of those who are unfortunate enough to get oral and pharyngeal cancer will not make it to 5 years? This 3D image is a patient of mine who was able to survive oral cancer. If you stick around, I will share with you his story and how we were able to screen him for cancer during the COVID pandemic. According to the National Cancer Institute, 60% of oral and pharyngeal cancer are detected in the ages of 55 to 74. Although cancer is much higher in men than women, there are still risk factors that can increase women's chances of getting it. Hi, my name is Dr. Dela Cruz, and I'm here with you today to share risk factors that could increase your chances of getting cancer, what we do in our office to screen for them, and that by visiting your dentist could save your life. The 5 main risk factors that increases your chances are tobacco use, smoking, e-cigarettes or vaping, heavy alcohol use, and lastly, history of HPV virus. Okay, so most people don't know that their dentists or hygienists are constantly looking for cancer. So here are the following ways we look for cancer in my office. Number 1, we are looking at your health history. So we ask you certain questions when you first come into the office. We're looking for tobacco, alcohol use, all these other things that I've already mentioned. These are the first signs we're looking for to see if you're at already an increased risk for cancer. Number 2, we're looking for, or we're doing a visual inspection. So when we're looking underneath the hood, moving your cheeks aside, having you turn your tongue, we're looking for certain things, okay? One of the first ones are ulcers. Although this is very common, what we're looking for is ulcers that don't go away after about 3 weeks, okay? The next one here are discolorations or lumps and bumps, okay? And then the last one are red and white patches that does not wipe away. The number 3 way we screen for cancer is using technology. The first one here is what is called a CBCT or a scanner. It allows us to look in 3D, and hint here, this is how I found my patient's cancer. The second one here is what is called a velscope. This allows us to kind of peer through the tissue and show us some abnormal tissues. Normally when you look at tissue, you're looking for redness and discoloration, but this actually allows us to peer into the tissue that might be abnormal, that could be potentially cancerous. Just because it's there doesn't mean it is cancerous. If we do see it, we'll usually follow up after a few weeks and check to make sure it's still there. If it is not, we'll refer you out to get a biopsy just to make sure that that is not abnormal. Okay, so if you made it to this end of the video, I want to say thank you for sticking with me. And so I wanted to share with you a personal patient of mine who showed up during COVID, and a lot of offices were closed at that time, and we happened to be open for emergencies. So this 66-year-old male presented to my office with pain in his jaw. He had been seen by a couple other dentists, and they told him that it really wasn't anything. And so he told me that the pain started about 10 days prior. And then when I ended up looking into the mouth, this is exactly what I saw. It was actually a bone spur, which is not uncommon, especially if you've had the tooth removed, and that could occur up to a couple months afterwards, okay? But not 2 years. So when he told me that this sucker was extracted 2 years prior, it threw up some red flags for me. He told me he didn't have any pain unless he really pushed on it. So what I ended up doing was I took a 3D image of this, and this is what I ended up seeing. And so, long story short, I told him to sit put. I called the oral surgeon friend of mine. I said, can you get him in and get this tested? A couple days later, he was actually undergoing the knife because what they found out, it was actually cancer. And so they had to resect that or remove that part of his jaw. They tried to reconstruct it a couple times with his own bone, but it actually didn't work. So they had to use a metal plate. Fortunately, he is with us here today. It's been 4 years since he's had cancer, but he is still living, and he actually thanked me when he walked through those doors 18 months later and said that you'll never guess what happened to me. Most dentists will recommend that you visit them twice a year for cleanings exam, but we do more than that. We're constantly looking for abnormalities that can potentially save your life. Okay, so I recommend that you visit your dentist regularly and be screened for these things. If you find this information helpful, please share it with others and subscribe. And if you have somebody that you know that may have had the same situation, please share it in the comment below. I'd love to hear them from you. Until next time, take care.